Hi, my name is Rob Bruley. I'm a medical physician and chiropractor both. I got my medical degree back in 1976 and continue to practice traditional medicine in conjunction with practicing chiropractic. I came to chiropractic school 25 years after I went to medical school. I graduated here from what was then the Northwestern College of Chiropractic in 2001, and I now maintain both degrees, and I finally discovered a type of medicine that I want to do such that I don't really even think about retiring anymore. Yeah, I think that in many cases people feel more comfortable perhaps taking lifestyle advice, exercise, diet, nutrition for me, because they know that I use pharmaceuticals, but I use that last, not first. And I try to do all these other things which oftentimes make the usage of these potentially side effect prone medications not necessary. And I think that people are very much interested in that. The other thing that does is it brings people to you that already have some of that mindset. And so you're not having necessarily to convince people to do that. They just want to find a way to do it better. So all of a sudden, instead of you trying to argue with somebody about why they should do this, you're having a team effort. So you and the patient, it's not, I'm the doctor, you listen to me. We're working together to solve the problem, and they're already kind of on your wavelength. So you tend to attract, in my experience, personally at least, more motivated people who often are very knowledgeable on their own health conditions and who've been enormously educational to me in terms of teaching me about new supplements, lots of books I've learned about from patients, testing things, dietary regimens, all these things have often been shared to me. So it's a back and forth, which is a really nice way to practice. One of the fascinating aspects that I really came upon through chiropractic school was functional medicine, which is helping the body function better. So often we were trained traditionally to recognize disease, where most people either initially had dysfunctions that were not recognized or addressed that then led to disease, or when they have disease, they have dysfunctions that are the underlying cause of what's going on. So let's say somebody has inflammation. Person A might develop diabetes, person B might develop cancer, person C heart disease, person D depression, and maybe the other person will just go happily into the sunset with no symptoms at all. But still, the bottom issue is inflammation, which you can address functionally by looking at how the bodies function through different systems, which is very much in line with what I learned here at Northwestern, and a very exciting way to practice, and a very greatly expanding field in healthcare in general. And again, I think it's to a large extent patient consumer driven, because people are reading about it. They want to try to get better. They don't want symptom suppression. There's a big difference in traditional medicine between acute care, in which it's very good at, and chronic care, which is often symptom suppression. And that's where I think the chronic care can be really improved, potentially minimized, or maybe even needed to be unnecessary through nutritional chiropractic type approaches. And that's a good thing, I think. So often it would seem that touch in a traditional practice was shaking hands, and then I touch them with a stethoscope, not my hands, a stethoscope. And then if I was often doing something to people, the nature of the practice would often cause me to do things that were actually painful and unpleasant and necessary, but not really exciting for either of us to do or fulfilling. I like the idea of a healing touch. I really feel that that's very, very therapeutic. And to be able to physically adjust somebody and make a problem go away, sometimes immediately, is extremely gratifying. As a personal example, I had a chronic problem with tennis elbow. Went the medical route, got it injected, did physical therapy, did exercises, ice, tennis armbands, get better, get worse. And then a chiropractor went and adjusted my elbow. Like in a half second, I was better, and it never came back. And I'm going like, again, why can't I do that? And I think that was something worth learning. It's clearly a better approach, and it's a place to start with. The way traditional medicine is going and demands of electronic medical records, a lot of times now people are becoming even less separated or less connected to their patients because they're having to enter data at the same time on a computer. I think that there's a great need for people to talk and touch and feel and listen. And I think that chiropractic offers that particular niche, which is really going to be increasingly demanded by consumers. And inevitably, all of us, whether we're physicians or not, are healthcare consumers. I don't think they ever said this in traditional medicine, but subconsciously, it was always like healing would come from without. What can we do to make you better? What pharmaceutical can we give you? What procedure we can do to you? Whereas chiropractic theory is very much in line with my own lifelong beliefs that healing occurs from the inside out. And you remove the impediments to the body healing itself. And it's amazing how well that works. I spent a lot of time talking to people about stress and sleep and bowel habits, and especially what happened in their life when they got sick. And you make all these little changes in those things, and oftentimes other problems just disappear and you're never sure exactly why. It's kind of like magic, but it's kind of fun.